In this video, we're going to be discussing how to plan the implant on the model and how to transfer that planning to our guide so that we can replicate it in the mouth. So after we've registered our guide to our model, we're going to go ahead and take that guide off. We're going to get our guide station. This guide station has 3 knobs underneath. They act to move up and down, these 3 screws on the plane. And then there is also one leg of the instrument that can be opened or closed for unlevel surfaces. Those 3 screws on the bottom act as a tilt table. So we're going to take our model. When we do a posterior implant, we slide the model all the way to the front and just close this thumb screw down. Look at it from the side. If it's a little uneven, we can take those 3 screws for our tilt table underneath and tighten those just slightly and make sure that we've got a nice level model on the table. We're going to be replacing tooth number 3. So there are slots for this post all around it. We want to choose the one that's directly opposite the implant site. So we screw the post in there. We've got a little tightening tool just to snug that in so that that post doesn't move. Next we have a little protractor tool that's going to be useful when we're doing x-ray corrections, but right now it's just going to serve to hold our positioning arm on. So we put the protractor, a little Teflon washer, and then we slide the positioning arm down. There are 2 big thumb screws, one here on the top, and that lets us have travel, buccal and lingual, and then the other one is on the positioning arm itself, and it goes mesial distal. We take out our alignment pin, put it into the divot in our model that we've previously made, stretch this positioning arm out just a little bit, and now we're going to be working with it. We're going to tighten this thumb screw, just put light pressure on it. Then we're going to take the other knob and put light pressure on it. Then we can take it and look at it from all angles and make sure that visually we're right in the middle of the 2 teeth that on either side of the implant, and that we're right over the alveolar ridge. Now we can take our guide that we've registered to this model, slip it on, and we're going to take our alignment pin and put it through the drill guide slot. You can see it's loose, so it's fully movable in all planes. We're going to capture it. This is spring-loaded, the top of this positioning arm, and it just nicely holds that in place. Once again, we're going to check it, make sure that that is the ideal drill path visually. At this point, we're going to take our largest hex wrench and tighten the first clamp. Then we're going to take the smaller hex wrench and we're going to tighten the screw number 2. And then we're going to go down here and do screw number 3. With all of these tightened, then that drill guide is going to be ready to go to the patient's mouth, and it will hold our 2mm pilot drill perfectly in this alignment, just as we had planned on the model and now as we have transferred to our actual guide. If we're confident that there's bone underneath there and we're ready to go, we could just get our 2mm pilot drill right now, go to the patient's mouth, we would have laid our flap if we're going to do flap entry, or we'll do a punch if we're going to do it that way. You'll notice we've got an open window. We can easily visualize right where the implant is going to be placed. And now we put our pilot drill into our handpiece, and we're ready to make that first pilot hole. Real easy and